I think this is an interesting case study to demonstrate our possibilities, for male patients who want surgical body contouring, which happens more and more. And there's a couple of things, that you have to bear in mind, and it's always very important to understand you can do different things with different people. So for me, it's a huge difference. Some male patients may come and possibly, be something like my age, and have, let's say, a little bit more skin on the loose side, a little bit more subcutaneous fat. You can get nice results for these patients, but it will be difficult, to do that really hard six-pack etching, if people have just too much fat under their skin. What we can do is, if you see the lower red angle, the red arrow here, you have the possibility to do some shaping work around the lateral edge of the lower rectus muscle. And that can be very gratifying, but not to try and do something which is ironically big as exaggerated here. If you have somebody with a lot of fat and a lot of skin, then trying to shape in a six-pack into their tummy might easily look a little bit ridiculous. So you might not do them a good service, and not everything looks good on everybody. So what I've picked is a case which I think represents this very well. You see a patient, moderately overweight with a lot of loose skin in the lower abdomen, gynecomastia too. That's I think it's a very typical, frequent case for those patients who approach us for male body contouring. And what we do here is you see the red arrow demonstrate that we do soft etching going into the lower lateral space, lateral to your natural six-pack muscle. And I think the biggest benefit for these patients you always see from the back, the little muffin top. That is what male patients perceive as most gratifying. Getting rid of this bulge, which usually with no dietary treatment in the world, you can get rid of this. So this, I think, is a good guideline, for males in the moderate overweight group, to have some guidance about what is possible and what not, to ensure you have a happy patient and avoid disappointments.